Well, according to a survey from the Angus Reid Institute, about 1 in 4 people in Saskatchewan do not have a family doctor. I recently spoke to one Regina woman who has spent the last 2 years calling clinics incessantly trying to get a doctor. She described her quest as the Hunger Games. And a survey of 16,000 Canadians by the Canadian Medical Association found that just 28% of respondents were satisfied with how our primary care system works. So today we're talking about what it's like to find a family doctor in this province. We'll talk about why this matters and what changes could be made to make sure more people have access to primary care providers. Of course, we want to hear from you. What's been your experience finding a family doctor? And if you don't have one, where are you turning to for healthcare? You can call 1-800-716-2221 or you can email bluesky@cbc.ca. And we've got a caller right off the bat here. We're going to go right to the phone lines where Jacqueline is on the line in Regina, and she's been on a hunt for a family doctor. Jacqueline, welcome to the program.
Hi, thank you so much, Nicole.
So what's been your experience trying to get a family doctor?
Well, I have had the same family physician, or I had the same family physician for 40 years. He's the same doctor that delivered me. And he took on the care of my partner and our 4 kids. And so I've been very fortunate up until very recently when he passed to have someone in my corner who I could call if things came up or attend clinic or get results or referrals or whatever I needed. So this is kind of a new game to me, and it's definitely been a challenge.
Did he ever talk to you about why he practiced for so long?
He did. A lot of it, honestly, was just his passion for care and the long-term relationships that he had with people. He obviously saw the need in the province. I know he helped out in some walk-in clinics and stuff over the years and took on more than his share of the caseload in Saskatchewan.
Okay, so now you're trying to get a family doctor for your family again. Why is this important to you?
Well, I mean, right now, everybody in my family is experiencing good health. But I know that obviously things can change when things come up or, for my kids, if they are sick or if something is a continuing issue. It's nice to have a point of contact and someone that you can build a relationship with, maybe when you're not in a time of crises. Mm-hmm. And so then if and when things come up, you have a point of contact, someone that you can trust, someone that you built a relationship, someone that kind of knows your history. And so I think that it's just important. I mean, I'm responsible for 4 young people. And so I think that that's something I can do for them. And then, I'm in my 40s. And so just as I navigate my own age and things come up, I would like to have someone on my side.
So what's been the process of trying to find a doctor?
Oh, this is actually probably the most difficult thing is that I feel like there isn't a process right now in Saskatchewan that's really well known. It seems to be, I think you had said that another caller had described it as the Hunger Games, and that's kind of exactly how I've experienced it in the short time that I've been looking for a doctor. And so it's like, okay, you can phone, a clinic that you hear is accepting patients, or you get a list of doctors accepting patients and you call them and, oh, no, we're not accepting patients, or that was only, for 1 hour on this day that we are accepting patients. Over the Christmas holidays, I was on vacation, and I spent 2.5 hours, phoning and rephoning a clinic in hopes to get a spot with these doctors that were taking patients. I didn't get it. Yesterday, I went to the same clinic because I had heard that they were handing out forms. But by the time I got there, all the forms were gone. And so it's just like, okay, well, maybe you can call back in February, or maybe you can call back in March, or, we're not really sure. And so it just feels kind of unclear. And then the other aspect also is just sort of navigating, I know that there's now funding for nurse practitioners to be primary care providers. And so, I mean, what would be helpful for me would be like a flow chart. Who needs a nurse practitioner versus a family physician? Is there like a database, or is there, a way to access that information? Because it's, for somebody who's able to advocate for myself and to able to navigate the healthcare systems. It's a challenge, and I can't imagine for other people that face lots more barriers than I do, that it would be even more challenging. And frustrating.
It does sound like a very frustrating process, and you're not trying, that's for sure. What options are you weighing right now then, I guess? Are you considering a nurse practitioner?
Yes, I think that's exactly sort of where I'm at is, perhaps a nurse practitioner could meet our needs again, because it's relatively new. I don't know a lot of people that have seen nurse practitioners, especially that aren't like paid for appointments. I know that, previously you could get a nurse practitioner and you could pay a certain amount of money, but then I'm like, well, do you pay that amount of money every time you go in?
Mm-hmm.
Yeah, it seems complicated to me. And so I guess it's just learning more. I think that there could be some more public education on how a nurse practitioner can fill the gap, and like if there are specific things that they can't do versus a family physician, what type of person should be seeking, because I don't think I'm special. I just want a primary care provider for myself and my family, but I'm just kind of questioning about how to navigate that.
Well, we hopefully can find some answers for you with our guests today. So, Jacqueline, I really appreciate you calling in today, and good luck.
Absolutely. Thank you so much, Nicole.
That was Jacqueline in Regina. If you want to share your experience finding a family doctor, you can call 1-800-716-2221, or you can email bluesky@cbc.ca. Now, our guests today have a unique perspective on the shortage of family doctors in this province. Darcy McGonigal is the president of the Saskatchewan College of Family Physicians. She and her husband are both doctors in Isla Crosse. Darcy is a full-scope family physician who also does ER, acute care, primary care, long-term care, and fly-in clinics. And in all her spare time, she's teaching med students, including Daniel Clark. He's expected to graduate with a medical degree from the U of S in 2028. Daniel is one of those elusive unicorns, one of those students who actually wants to pursue rural family medicine. Darcy McGonigal, Daniel, welcome to Blue Sky.
Hi, thanks for having us.
Dr. McGonigal, I want to start with you. We just heard from Jacqueline, who has been really struggling to find a family physician. How often are you hearing from people in that similar situation?
Yeah, Nicole, unfortunately, this is a story that we're hearing all too often, both from the public, from friends and family. I think everybody knows someone who is going through all of the motions that Jacqueline is going through right now, whether personally or they know a number of people doing the same. And also from the family physician perspective, I think all of us, we get called and emailed and asked by friends, family, acquaintances on a daily basis if we know of anybody accepting patients, if we'll accept patients, if we can figure out a plan for somebody. So yes, unfortunately, Jacqueline's story is very common. I mean, it definitely warms my heart, her intro talking about her experience with her longtime family physician, somebody who was an important person in her family's life, obviously, who was very dependable and had that continuity of care that is the dream. Unfortunately, we're seeing, a shift in the healthcare landscape in primary care, where we no longer have fellows like the physician that Jacqueline was speaking of. I mean, we still do, but more and more we're seeing people who aren't doing that continuity of care, longitudinal practice throughout the lifetime of their patients, and not providing that full scope of practice. And there's many reasons for that, but I think we're looking at ways of how we can adapt and still provide access to primary care for the people of Saskatchewan despite this. But I love her description of how family physicians played a central role in her life and in her family's life, and how she's seeking that. And it's our goal, obviously, to make that happen for as many people as possible. Ideally, every person in Saskatchewan.
Yeah, I mean, how has there been a change over time? Like, what you did talk about the change, but like, why? What has actually happened to shift that landscape?
Yeah, I mean, I think in previous years, decades ago, you had the lifetime family physician who would open a practice, take a panel of patients, a group of patients, and follow them from cradle to grave, do everything for them, meet them in emergency, admit them to hospital, etc. And that can be really amazing care because that person knows everything that you've been through, delivered your babies, delivered you. And, that's a pretty special experience. But it's something that isn't truly sustainable in kind of the current day of people physicians wanting more work-life balance, to be honest, that they can't be on call 24 hours a day, 365 days a year for patients, that they also want some time off, that they maybe want to not practice the full scope and focus on a certain area of practice. And that is not something that is negative necessarily. We have some amazing family physicians that have focused practices in a number of different areas, addictions, emergency, so they are all filling very important roles, but it has meant that there's been a shift away from this kind of cradle to grave type practice.
Darcy, you have a special interest in rural Saskatchewan. You practice in Isle of Cross. What's the experience like in rural Saskatchewan for people trying to find a family doctor, rural and remote, compared to, Jacqueline trying to find one in Regina?
Yeah, I mean, every rural location is a little bit different, but I think in the Northwest, in my area, so Isle of Cross is the community where the hospital and the primary clinic is situated, and where we're a group of physicians who work together as a team in order to provide care for a geographical area of the province. So kind of Isle of Cross and 250-kilometer radius around Isle of Cross, which includes a number of communities. So we're fairly unique in that if you live in Isle of Cross and surrounding area, we are your family doctor, and not everybody might realize that or identify with that. But if they have a care need, they can go to their local clinic, they can come to Isle of Cross, the emergency, and we are the provider for them, and we will take on their care as their primary care provider. And so, there's not really anybody that needs to call around for to get into a family physician. Now, it's not that we don't have issues with access. We have a lot of shortages of physicians. We've had lots of clinic cancellations, especially in the past year or two, and moving forward. So it's not like it's don't everybody come travel up to Isle of Cross to find a family doctor, but please don't. But what I'm getting at is that we have a unique situation where if you're in this geographical area, then we're your provider. So that takes away that stress of calling around for sure.
Danielle, I'm coming to you in just a second here, so don't worry, I haven't forgotten about you. But I just want to ask Darcy McGonigal, what is it like being a doctor in a smaller community in more rural Saskatchewan? You've been doing it for a while. Why do you do it? Why do you like it?
My husband and I, we've been up here basically since we finished our medical training, so for 15 years. And we really loved the style of practice that this was. It is a full scope cradle to grave practice. So there's people that I've cared for them. I care for their parents, I care for their kids. I love the community engagement that we have here. We're also have been sports coaches. We also are very involved in, that type of thing. So I grew up in a small town in the South, but I just love that aspect of really engaging with community and building trust over time. I think it's a also should be said, like in Indigenous communities, they've had to deal with a lot of turnover over time, and you can have a lack of trust in the medical community because of that. And so I feel like part of something that I could contribute to that was staying in one place for a longer time. And I feel like we've built those relationships over time. And then I've been able to be put in a position where we can advocate for communities for better care, for better access. I love rural family medicine. I'm a big fan. So, but I also, like Jacqueline obviously is from an urban center. I feel, access in urban locations is so challenging as well. So it's a problem all over Saskatchewan, but that's kind of like my passion is rural family medicine.
So Daniel, not to put too much pressure on you, but you're the hope. You're what everybody's pinning their hopes on. You're still in med school right now. What kind of exposure do you get to family medicine as part of your training?
Yeah, well, there's quite a few opportunities, and I know the medical school is definitely emphasizing family medicine and trying to give people.
Do you feel that? Do you feel like they're kind of pushing you in that direction?
Well, I think as a whole medical school, they are. That being said, of course, individual doctors, they might have differing perspectives, or perhaps like differing some subconscious biases or whatnot. But yeah, like as a medical school, they are definitely trying to give us more exposures. So for example, like throughout the first 2 years of medical school, we have, family medicine clinics where we like shadow a doctor, kind of shadow them for a few hours, help them out. Well, help them out. In reality, it's really just learning from them. But yeah, just getting that exposure.
And what is it about it that you liked when you were experiencing that family medicine part?
So like I came in already having an idea of that I was interested in family medicine. But for me, what really attracts me, well, there's several elements, but one is like the diversity of practice, especially in rural communities. I was actually able to visit Isle of Cross and some other rural communities in Saskatchewan and shadowing some family doctors, and just the opportunity to be able to do longitudinal family practice, but then also be able to spend some time in the ER, perhaps do more procedural skills like excisions, vasectomies, or other things, depending on what I'm interested in. So that was something that really attracted me. And then also just like the ability to build long-term relationships with patients. That's something that, especially growing up, that was something that was really emphasized and something that I really enjoy.
How many students are in your class?
There's around approximately 104. So around 64 of them are in Saskatoon, and then like 40 of them are in Regina.
And if you had to hazard a guess, what percentage of your classmates want to practice family medicine?
That is very difficult, especially because I only know like the year two students, and we haven't had a lot of exposure to family medicine, just because we get the exposure, like the clinical experience in third and fourth year. But yeah, right now, maybe 15%. That being said, I know as students experience hospital work and whatnot, the percentage does increase in third and fourth year. So I find it very difficult to put a number just because...
Yeah, that was probably an unfair question to ask you. But I'm just, curious, like, if you're getting vibes from folks. And I'm curious about that decision-making process because, I mean, we also hear a lot about, a shortage of specialists in this province too, in a lot of different fields. And, if you have to make that decision between becoming a specialist or practicing family medicine or working in an emergency room, what are you considering when it comes to the pros and cons? Is it a work-life balancing as Dr. McGonigal had talked about?
Yeah, I think work-life balance, at least especially for me, that's a major factor of just being able to have, and even just like the 2-year residency, that's a factor. And then, the diversity of practice and just the flexibility. I heard a doctor kind of describe it as choose your own adventure, where you can, go into longitudinal practice. But then if you're interested in certain kind of niche specialties like women's health or labor and delivery or other things like that, you can, in addition to doing longitudinal family practice, kind of dabble in other areas as well, depending on what you're interested in. So that's something that, as somewhat a jack of all trades, something that I really enjoy.
We got an email from Robert who writes, I was fortunate to find out about a clinic accepting new patients through a Facebook group. I arranged for what was billed as a meet and greet. I went hoping to have a dialogue with my needs and their scope of practice. Instead, the doctor came in, sat at the computer and asked, how can I help you today? This is what would happen at a walk-in clinic. I guess beggars can't be choosy, but it did not start us off on the best foot. There needs to be clarity about what a meet and greet is. I heard some providers were charging for a meet and greet because it did not involve any care. My research showed that this meet and greet without any service provided is not billable. Dr. McGonigal, do you have thoughts on that email from Robert?
Yeah. I myself, our practice, we don't do anything like a meet and greet. But we are a unique payment structure. We're actually salaried physicians under Northern Medical Services, which is a division of the University of Saskatchewan. So it's a totally different payment structure than what a lot of physicians would be working in an urban area who would do these meet and greet appointments. I personally feel like if you're going to have an appointment and you're billing the province, and maybe that's what this physician was doing, was it's a meet and greet, but also can I take care of some of your care needs right off the bat? You know, like, are there something that we want to tackle today, get to know each other a little bit, and then we'll kind of develop that relationship over time. I don't know, but I do know that this is kind of a phenomenon, but it really is more so in the urban centers. And honestly, it's, if you have a really good starting point, a really good overview of the snapshot of the person in front of you, then you can kind of assess their care needs and make some plans for the future with them. And that's, I think, what people are getting at with a meet and greet type appointment. But I think it's really important to also address any urgent care needs, because lots of people they've got some things on their list that they kind of need to deal with, right? Yeah, I can't wait for another 3 months to get back in to see you. And then we start getting into the meat of things. So, unfortunately, I kind of want to speak a little bit. You mentioned this person found access through like a Facebook page. And we've been hearing a lot of stories about how are people, connecting with care. Jacqueline mentioned, this like Hunger Games type approach of calling all these different clinics, spending our holidays calling around to clinics, walking into clinics and looking for forms. Like, it is exhausting. And it's one thing that the Saskatchewan College of Family Physicians is really focusing our advocacy on right now with the provincial government, because we feel like this is a crucial thing that is a transparency issue for the public, and also to ease the burden on both the public and physicians' offices. So what we're seeing right now is people doing all their own calling, and also the burden on the physician clinics who are fielding like hundreds of calls a day from people. Hundreds.
It can be a better
of calls
process.
A day.
We'll talk
exactly.
more about that, because we'll also hear from a Saskatoon man who's taken it into his own hands to try to make a database. Right. So that'll be coming up. We've been hearing today about what it's like trying to find a family doctor in Saskatchewan. If you want to share your own experience, you can call 1-800-716-2221, or you can email bluesky@cbc.ca. We were just hearing from Darcy McGonigal, who is a doctor here in Saskatchewan, and she was talking about the need for a better system for people to connect, for the public to connect with doctors' offices. And she's not alone in that thinking. After noticing more people growing desperate to find a family doctor in Regina, David Namdi said he decided to take the problem into his own hands. The 23-year-old recently started a website to connect people with doctors accepting new patients in Saskatchewan's capital. NAMD's website is called Doc Mio. He joins us. He joined our producer, Joelle, and he told her a little bit about why he was doing this.
I've called Regina home for a chunk of my adult life. And, I've also worked in community health and primary health care. It's been something that I've dealt with my own self. And, I've got friends. Having worked in those places as well, you get to meet a lot of people who have several very diverse concerns, so many of which they, A, wouldn't have if they have family physicians, but B, wouldn't be able to actually deal with because, healthcare kind of revolves around a home office. Your family doctor would be who you would reach out to kind of coordinate some of those other things. So yeah, it became it's a very glaring need. I think it was something I realized right off the hat, but I think everybody in the city can see that as well. I did graduate from medical school. I didn't. I am not practicing. I'm kind of focusing on my other goals in health policy generally. So I'm doing a master's right now. But yeah, having that medical background certainly did help sharpen my lens a little bit on some of the problems, and especially seeing what the real need for family physicians, the jobs they do, how very important they are. Even if you do have an acute condition that or chronic condition, well, typically any kind of conditions you have, even if you do have to see a specialist, you do still need a family doctor to kind of coordinate your care. So you're the one who gives out referrals to specialists. You're the ones who the specialists are going to send out your notes to, if you need. You can't just book an appointment to see a specialist, for instance. They would have to, they're going to be the ones giving you a call. So you can't just go to your dermatologist and be like, hey, I'm going to book an appointment with you, right? So it's almost like a home, like a medical home for the most part, where, clients who need help or who are having some kind of health issue would the primary contact, and they're called primary care physicians for a reason, not because the work they do is little or is to be belittled, but it's because it's primary in that sense. Is very vital to their good health. And so, if that piece breaks down, if you have people who cannot access that primary care, the secondary care becomes even so much more difficult to attain. It's not a problem that's particularly unique to a city or to a province even. It's a worldwide thing. We have there is a severe shortage of primary care physicians around the world, but so it's like expected. If you live in a city like I do in Regina, it's expected. It's difficult to find some of those. Some of that care, and it's even much more difficult when it's not very accessible. The hope, obviously, would be that primary care physicians or clinics in general are find a tool useful enough for them to go in, and it's kind of I've made it as easy as I could. It's less than 30 seconds to actually sign in, and it takes even shorter than that. Every 60 days, they're going to be getting an update link so they can log into the email. They can log into the profile, and they can do all their changes. And it takes a really short time, and I can understand that. It's also for someone who worked in primary health and community health. It's the staff is as busy as it is right now, and so my priority when I was creating it was to make something that was actually accessible, that was usable, that was simple to use. My goal would be the clinics in the city would be willing to use to find the tool useful enough that they and the other piece to it is it's kind of when you're a front staff, for instance, working in clinics, the tone of the calls you get are going to be related to if your clinic is accepting new patients or not. And I think that also points to the problem that we have in the city, right? Because lots of people are calling in 20, 30 clinics every whenever they need to find a new doctor, they're kind of trying to find one in the entire city. And so the goal is we kind of reduce that call, that burden on the administrative staff for the clinics themselves, but also make sure that the tool that there's accessible to them is really easy to use, is really convenient, and they don't spend a ton of time on working that out.
Health. That was David Namdi. He created a website in hopes of connecting people with their family doctor. It's called docmiyo.ca. I just looked at it, and there's not a lot on it yet, so I don't know if it's if there just aren't a lot of available openings. But Darcy, you were talking about the necessity for something. I mean, this is just a guy in Regina who sees a need. What would you like to see and what kind of conversations are you hearing right now that with the Ministry of Health?
Yeah, so we've been advocating for some time for a registry, ideally a physician and patient registry for primary care. So what that would look like would be if you're a patient who is not attached to a primary care provider, whether that's a team led by a family physician or a family physician's office, then you would put your name on this list. And then on the other side, you have all the providers in the province continually updating kind of how many spots they have open in their panels of patients, how many they can take on. And ideally, there's someone in the middle who is kind of doing this, looking at it from a needs-based geographical standpoint and kind of matching people up. Now, we see lots of different examples of this across the country. BC actually had quite an impressive one, and they've been able to then come back and say, this is how many people we've been able to attach to primary care in the past month. So we can kind of track that, because we don't have very clear numbers right now of even how many people the number that you mentioned at the beginning, 1 in 4 say they don't have a family doctor. We've got kind of like piecemeal data from here and there, usually from surveys, but we don't have really hard data on how many people have access or are attached. And then there are some examples, like in Nova Scotia, for instance, where they're kind of, developing the registry, but they just kind of said, like, you know what, we need to be transparent in what we're doing. People go on a website, they say, I need a family physician. You're on that website, and then once you become attached, you notify the program, and then they take you off so that they can at least kind of track numbers in the province. We kind of want something a little bit more facilitative than that. So what we're doing as the Saskatchewan College of Family Physicians is we just last week, at the end of the week, released a petition, a petition for family physicians to sign to advocate to the ministry, and also from public, from patients who are struggling with this, to say, we really feel this is important. Having access to primary care is necessary. Now, this doesn't solve the numbers game, but it at least takes away that Hunger Games piece.
It probably at least helps give a sense of how many people are looking. Too.
Exactly. Yeah.
Well, I want to go back to the phone lines because we have Sally on the line in Regina. Sally, welcome to Blue Sky.
Hi. I was just going to make a couple of observations. I'm a dinosaur family doctor who practiced continuity medicine for 40 years, recently retired. And I fully support, what Darcy's saying about trying to solve this problem, getting rid of the Hunger Games. But I think it probably makes sense for us to think systems-wide a little more broadly. We have a government that's talking about opening up more urgent care centers, which are kind of the opposite of the kind of medicine that Darcy is talking about, where we have continuity and relationships. We have some models in Canada. The former health minister, Jane Philippot, has written a book saying, maybe we could have initiatives like a primary care center in every high school. This wouldn't apply to rural, but it would certainly address some of the issues in urban Saskatchewan, where in a high school you would have a team of primary care providers that would include, physicians, nurse practitioners, whatever else is specific to this community's healthcare needs. And if you move into that neighborhood, just like if you moved into the neighborhood your kids go to that school, if you moved into the neighborhood, you would get healthcare in that primary care center. I think that would be a much more useful approach than more urgent care centers that we can't even staff. At the recruitment end of it, I was interested in the medical students' comments. We know there is a hidden curriculum in medical school whereby kids who come into medical school wanting to be primary care providers get the vibe that being a specialist is more important, that having, highly skilled, specialized knowledge about one little thing is more important than knowing a lot about the general population you're dealing with. And that hidden curriculum does discourage people from becoming primary care providers at the end. Now, we're never going to go back to people having a one-on-one continuity relationship with a doctor, but we could go back to a system where people have relationships with a team. And I even wonder if we shouldn't have a special stream in medical school for people who want to be family doctors. That said, I want to comment on the medical students' idea that you can choose your own adventure in medicine. I think that's the fundamental problem, is that our physicians are, in fact, small businessmen, and they decide what kind of medicine they want to do, what kind of adventure they want to have in medicine, as opposed to us deciding as a society what do we need doctors to do. The sort of analogy being teachers. Teachers don't get to decide, well, I only want to teach this small group of people, ages, 9 to 11, and I only want to teach them science. That's not how teachers work. They take a job and they do what the society needs them to do. And that's really what's missing here is that doctors are not, they're private contractors, and they decide what they're going to do with their adventure as opposed to what the society needs from physicians. That said, we'd have to make some very fundamental changes in our funding models if we were going to be able to mimic this model that Dr. Philippot has talked about. Those are my comments. I hope they're helpful.
That's a lot. It's a lot to chew on there, Sally, but congratulations on your retirement, and thank you so much for calling in today. I really appreciate it.
Okay.
So Sally brought up a lot of things there. I saw both of you nodding along. Daniel, as a med student, I want to come to you first.
Well, one thing that she mentioned was kind of the hidden curriculum, and I would definitely agree. In fact, I was actually chatting with a few students, asking them, what kind of dissuades you from pursuing medicine? And one thing that they actually mentioned was, unfortunately, the idea of prestige, that somehow like family doctors are less than specialists, or that you don't want to, quote unquote, settle to be a family doctor. And in fact, I've even shared this with other people that I want to be a family doctor. And some people even mention like, oh, you just want to be a family doctor, as if that's somehow less, or that if you're really driven or if you're intelligent, you should pursue to become a specialist. And unfortunately, that still exists in medicine, but it also exists in the broader community. People have that, subconscious bias regarding family medicine. So that was something that I definitely agree with.
And Darcy, there's so much there that she brought up, and even team. I know that we've talked in the past about more the team-based approach, and that's something that we're moving. Before we get to the end of the show, I want to read the statement from the government, because we did ask the Ministry of Health if they could have somebody be part of our program. No one was available for the show today, but they issued a statement. And just to be in fairness, I want to get it on before the end of the show here. So the statement says, our government is committed to ensuring everyone in Saskatchewan has access to primary health care providers, either a doctor or nurse practitioner, by the end of 2028. So you can circle that date in your calendar, folks, 2028. The Ministry of Health is providing significant investment to expand and enhance programming targeted to recruiting and retaining physicians. Since 2022, the number of physicians practicing the province has grown by 346 under the province's ambitious Health Human Resources Action Plan. Our plan includes expanded medical residency seats, increased Saskatchewan International Physician Practice Assessment, placements, and a new mentorship and support program to help address long-term retention of physicians assessed through SIPPI. Currently, there are 53 seats annually offered through that program. Saskatchewan is training more doctors at home. 8 additional undergraduate seats have been added for medical students at the University of Saskatchewan, bringing the total medical student seats to 108. Medical residency seats recently expanded through the U of S from 140 to 150 annually. This includes seat increases to support specialty training seats such as family medicine, expansion to the southeast area of the province and to the northeast in July of 2026. And as part of strengthening primary care, the provincial government's Innovation Fund is helping 28 physician-led clinics across Saskatchewan test new team-based care approaches that improve patient access by expanding frontline teams. The fund has supported the creation of more than 56 full-time equivalent positions to date, including roles for nurses, nurse practitioners, licensed practical nurses, social workers, pharmacists, psychologists, elders, and other clinical staff. And they're expanding the role of nurse practitioners in this province through additional funding. So we know that off the bat of the show, we heard that Jacqueline is considering a nurse practitioner because she can't find a family doctor. She had questions about if that's right for her, when a nurse practitioner is the right call for you, or when it should be a doctor. Darcy, there's a lot there. Pick your poison.
Okay. Yeah. Well, you mentioned the team-based care piece, and Sally had also mentioned that. As the College of Family Physicians and just as a practicing physician, I really do see the future in team-based care. I also have been paying very close attention to Dr. Jane Philpott's her book, and now a lot of the primary care changes that they're making in Ontario, and it's going to require some bold changes to the structure, to payment models, to kind of everything across the board in primary care. And I do know that the province, the Saskatchewan Health Authority, that we are coming up on a year of change and looking at where we can kind of integrate team-based care across the board. But it's going to require commitment and funding from the government to make this come through. You know, there's been a lot of talk about the reforms, and now we want to see, let's get these reforms moving. So for instance, it might not mean that you're increasing the number of physicians in a location, but it might mean, you're adding a nurse practitioner, you're adding a social worker, you're adding a nurse navigator to your clinic. And within that team, you can increase the access that your patient population has so that you can see them in a more timely fashion, more efficiently. You might not see your physician every single time, but the team they're the ones who are kind of quarterbacking what the team around them is doing. So, like Jacqueline mentioned, like getting a call about some results from their family doctor. These are the kinds of things that the team can kind of fill in so that everyone can kind of work at what we call top of their scope, so that maybe the family physician can see the kind of more complex, deal with some of the more challenging pieces, while their nurse navigator can call and say like, hey, all your lab work was normal. Let's follow up in a couple of months. So these are the types of models that we're really looking to transition to. And yes, I really do love the concept of you are in an area, you are going to have a primary care team who you are just attached to if and I'm not sure that's going to take a lot of innovation and work. It's there's going to be...
I think there's a desire, right? Because Kathleen Regina writes, and she says, I'm a member of the Regina Community Clinic for the last 25 years. I never had to worry about having a family doctor, but I would love to get my husband into the clinic. Unfortunately, they're not accepting new patients. My question is, why aren't there more community-style clinics in our province? And is there any way to advocate for more than being established?
Yeah. we're advocating for it all the time. And what we hear from, medical students and residents like Daniel, like a lot of people coming out of residency, a lot of them are not interested in being business owners, hanging up a shingle and saying like, I'm open. I'm going to start taking patients, picking out the chairs that they have in their office. More people are interested in being part of a team, joining a group that's established, and then you work as part of their team. You have a contract. You don't have to worry about billings and things like this. Like, it's an alternate payment model. And so we're really looking for more practices that are going to transition into that. And that's part of what they're working on with some of this transitional payment model for physicians, the Innovation Fund, kind of really encouraging moving away from a fee-for-service model to something that is going to be more inclusive and sustained team-based care.
And Daniel, I mean, I don't know if you went into med school because you wanted to run a business, but is that something that's on your mind about the business running aspect of it and wanting to see a shift in that?
Yeah, that's definitely one downside of family medicine is like the administration, which is if there were opportunities, and I know that there are, especially in rural communities where that's less of an aspect of your work. Yeah, I would be all down for doing the medicine, which is what I was trained for, not the administration and the business owning.
Well, I feel like we needed 5 more shows or 5 more hours because I did, I spoke to other people who had, talked about their own experience of getting a family doctor and then that family doctor leaving within, and then someone else leaving in that clinic. So she's like, maybe getting a family doctor is not so hard. It's keeping one and the retention aspect of it. So maybe we'll have to save retention for a whole other day. But Darcy McGonigal, I just want to leave you with the last word. What do you want people to know who are at home right now struggling because they don't have a family doctor? They're wondering, should I get a nurse practitioner? What's your last advice to them?
Yeah, I mean, first of all, I feel for everybody who is in that position, and that's part of why I've gotten engaged with SCFP as an organization to kind of look at what are the system things that we can do to help shift this. I agree with, as Sally had mentioned, having a registry is just one part of the puzzle. We got to look at bigger system things, but that is one thing that, advocate for yourself and others by signing this petition. Go to our website, saskcfp.ca, and sign that petition. We will be taking it to Minister Cockrell, Health Minister, at some point once we gather enough names. And we just really feel like there's much that can be done in order to increase the attachment to family physician and primary care teams. And so we're going to keep advocating on all the public's behalf.
Well, thank you so much.
Thank you for having us.
That was Darcy McGonigal. She's a family doctor, Nyla Cross, and president of the Saskatchewan College of Family Physicians. I was also joined by Daniel Clark. He's expected to graduate with a medical degree from the U of S in 2028. And he's one of those students who actually wants to pursue rural family medicine. So, Daniel, to you and to all your classmates who are going to be taking care of this province, thank you so much for your work.